Dear friends, in our mission to bring you the most scientific and helpful health knowledge, Health Hub recognizes that one of the most important topics is cardiovascular health. Heart disease, with its complexity and alarming prevalence, is a major challenge to public health. Every year, millions of people worldwide face dangerous complications from this condition. But here at Health Hub, we believe strongly in the power of proactivity and accurate knowledge. We can absolutely make a positive impact on our heart health through lifestyle and especially nutrition. In today's in-depth video, Health Hub will explore with you 7 types of vitamins and nutrients highly regarded by medical and nutrition experts, viewed as golden keys to building and protecting a healthy, long-lasting heart. If you're looking for reliable information to care for your heart scientifically, join Health Hub as we dive into the detailed content right now. Cardiovascular health isn't just about not having heart disease. It's about having a circulatory system that functions optimally, ensuring sufficient oxygen and nutrients are delivered to every part of the body, sustaining life and quality of living. A healthy heart is the foundation for a healthy, energetic body. The risk factors for cardiovascular disease are very diverse, ranging from genetics, age, to modifiable behavioral factors like smoking, sedentary lifestyle, being overweight or obese, chronic stress, and especially suboptimal nutrition. Modern nutritional science has provided clear evidence of the pivotal role of diet in controlling these risk factors. A diet rich in whole foods like fruits, vegetables, legumes, nuts, whole grains, and lean proteins not only provides energy but is also a treasure trove of beneficial vitamins, minerals, and phytochemicals that help reduce inflammation, stabilize blood pressure, manage cholesterol, and improve blood vessel function. At Health Hub, we understand that building a perfect diet can be challenging in today's busy world. Therefore, understanding the role of specific essential nutrients and how to ensure we get enough of them, sometimes requiring support from supplements, is crucial. Now, without further delay, let's join Health Hub to discover the 7 golden keys of nutrition your heart needs to perform at its best. Key number 1: omega-3 fatty acids, the blood vessel cleanup crew. First on our list, we cannot fail to mention omega-3 fatty acids. In the medical and nutrition community, omega-3s are consistently praised for their wide-ranging health benefits, especially for the cardiovascular system. Omega-3s are essential polyunsaturated fats, meaning our bodies cannot produce them and must obtain them from the diet. There are 3 main forms you should remember. EPA, eicosapentaenoic acid, primarily found in fatty fish. DHA, docosahexaenoic acid, also primarily found in fatty fish and algae. DHA is crucial for cell structure, especially in the brain and retina, and is also beneficial for the heart. ALA, alpha-linolenic acid, found in plants like flax seeds, chia seeds, walnuts. The body can convert ALA to EPA and DHA, but this conversion rate is often quite low. So, how do omega-3s help the heart? Their scientifically proven benefits include reducing blood triglycerides. This is the most well-established benefit of omega-3s, especially EPA and DHA. They effectively lower high levels of triglycerides in the blood, a significant risk factor for heart disease. The mechanism involves reducing the liver's production of triglycerides and increasing their breakdown. Helping to lower blood pressure slightly, omega-3s can help relax blood vessels, reducing pressure on artery walls, which is particularly beneficial for people with mild hypertension. Preventing blood clot formation, omega-3s reduce the stickiness of platelets, helping blood flow more smoothly and decreasing the risk of clots that can block blood vessels. Anti-inflammatory properties. Chronic inflammation is a foundation for many diseases, including atherosclerosis. Omega-3s have strong anti-inflammatory properties, helping protect blood vessel walls from damage, slowing the progression of atherosclerosis by reducing inflammation, improving endothelial function, and potentially impacting plaque stability. Reducing the risk of arrhythmias. Some studies suggest omega-3s can help stabilize the electrical activity of the heart. The richest food sources of omega-3 are cold water fatty fish like salmon, mackerel, herring, sardines, and anchovies. For vegetarians or those who don't eat fish, nuts like flax seeds, chia seeds, and walnuts provide ALA, or consider supplementing with DHA, EPA from algae oil. However, achieving sufficient levels of omega-3s for significant cardiovascular benefits from food alone can be challenging for many, especially EPA and DHA. Supplementation with fish oil or algae oil is a common option. Supplement dosage should follow recommendations and consider your health status, ideally with consultation from a healthcare professional, especially if you are taking blood thinners. Key number 2: vitamin D, more than just the sunshine vitamin. Next, we'll talk about vitamin D. Often known for its crucial role in bone health, vitamin D is now recognized for its significant impact on many other aspects of health, including cardiovascular health. Vitamin D actually functions as a pro-hormone and has receptors on many cell types, including heart muscle cells, vascular endothelial cells, and immune cells. Studies have shown a link between vitamin D deficiency and an increased risk of cardiovascular diseases. The mechanisms by which vitamin D affects heart health include regulating the renin-angiotensin-aldosterone system, RAS. This is the primary system controlling blood pressure. Vitamin D helps keep RAS balanced, preventing its overactivity, which can lead to hypertension and blood vessel damage. Vitamin D deficiency can contribute to RAS overactivity, reducing inflammation and modulating immunity. Vitamin D can modulate inflammatory responses in the body, helping slow down the process of atherosclerosis. It also acts as an indirect antioxidant. Both inflammation and oxidative stress contribute to plaque formation. Improving endothelial function. The endothelial lining of blood vessels plays a critical role in regulating blood vessel dilation and constriction. Vitamin D helps maintain the healthy function of this lining, ensuring proper blood flow, reducing arterial stiffness. Adequate vitamin D levels may help prevent the stiffening of artery walls, a factor linked to hypertension and atherosclerosis. Association with heart disease risk. Numerous observational studies have shown a correlation between low blood vitamin D levels and an increased risk of cardiovascular diseases like hypertension, stroke, coronary artery disease, and heart failure. While more large clinical trials are needed to confirm causality, this association is notable. The most effective natural source of vitamin D is synthesis through the skin upon direct exposure to UVB rays from sunlight. However, many factors, geography, season, time of day, cloud cover, pollution, skin tone, sunscreen use, time spent indoors, reduce this synthesis capability. Some foods contain vitamin D such as fatty fish, cod liver oil, egg yolks, UV-treated mushrooms, and fortified products like milk, orange juice, and cereals. However, it's very difficult to get enough vitamin D from diet alone. Given the high prevalence of vitamin D deficiency, testing blood levels to check your vitamin D status and supplementing if needed is a recommendation from experts. Supplement dosage needs to be personalized and should involve consultation with a healthcare professional to ensure safety and efficacy. Avoiding rare instances of toxicity that can occur with extremely high doses over prolonged periods. Key number 3: vitamin B9, folic acid, the warrior against homocysteine. Moving on to AB vitamin, we have vitamin B9, also known as folate, natural form, or folic acid, synthetic form. Its role in cardiovascular health is linked to its ability to handle a potential troublemaker in the blood called homocysteine. Homocysteine is an amino acid produced during protein metabolism. At normal levels, it's harmless. However, when homocysteine levels in the blood become high due to deficiency in vitamins B6, B9, or B12, It can directly damage the inner lining of blood vessels, endothelium. Accelerate atherosclerosis, plaque buildup in arteries, and increase the risk of blood clot formation. High homocysteine levels are considered an independent risk factor for cardiovascular disease, stroke, and other vascular conditions. Vitamin B9, along with B6 and B12, acts as coenzymes in the process of converting homocysteine back into methionine or other harmless compounds for elimination. By keeping homocysteine levels healthy, vitamin B9 helps protect blood vessel walls from damage. Folate is abundant in many heart-healthy foods: dark leafy greens, spinach, asparagus, broccoli, legumes, lentils, chickpeas, black beans, whole grains, animal liver, citrus fruits, and avocado. However, folate from food can be lost during cooking, and absorption rates can vary among individuals due to genetic factors or digestive issues. Folic acid, the synthetic form, is generally absorbed more effectively and is used to fortify common foods like bread and breakfast cereals to help prevent deficiency, which is particularly crucial for women of childbearing age to prevent neural tube defects in infants. For individuals with high homocysteine levels, which can be detected by a blood test, or those at risk of B9 deficiency, supplementing with folic acid may be a strategy recommended by a doctor to reduce cardiovascular risk. While the effect of folic acid supplementation alone on reducing major cardiovascular events is still under further research, its role in managing homocysteine is clear. Folic acid supplementation is generally safe, but high doses can mask the signs of vitamin B12 deficiency. So monitoring is needed if taking high doses long-term. Key number 4, magnesium, the coordinator mineral for heart health. Next, we discuss magnesium, an incredibly versatile mineral involved in over 300 enzyme reactions in the body, including those vital for cardiovascular health. Think of magnesium as a coordinator, helping everything run smoothly. Magnesium is essential for normal muscle and nerve function, including the heart muscle and the heart's electrical conduction system. It also plays a role in regulating blood pressure, blood sugar, and the activity of other ions like potassium and calcium. Magnesium deficiency, which is quite common due to modern diets often lacking magnesium-rich foods and influenced by stress, alcohol, and certain medications, can contribute to several heart issues. High blood pressure. Magnesium helps relax the smooth muscles in blood vessel walls. When magnesium is deficient, blood vessels can constrict, increasing peripheral resistance and leading to high blood pressure. Magnesium supplementation has been shown to help lower blood pressure, particularly in individuals with hypertension and magnesium deficiency. Arrhythmias. Magnesium is crucial for the proper movement of potassium and calcium ions across cell membranes, regulating the heart's rhythm. Low magnesium levels can cause or worsen various types of arrhythmias, including dangerous ones like torsades de pointes. Atherosclerosis. Magnesium may help prevent calcium buildup in artery walls, reducing the risk of arterial stiffening. It can also have positive effects on cholesterol and triglyceride levels. Supporting potassium function. Magnesium is required for the body to utilize potassium effectively. And as we'll discuss next, potassium is also vital for the heart. Notably, magnesium is particularly helpful for people taking certain blood pressure medications or diuretics, as these drugs can sometimes increase the excretion of magnesium through the kidneys, leading to deficiency. Magnesium is found in many healthy foods we should eat daily: pumpkin seeds, sunflower seeds, almonds, cashews, dark leafy greens, spinach, kale, legumes, black beans, lentils, whole grains, oats, brown rice, quinoa, fatty fish, avocado, and even dark chocolate, with high cocoa content. If you're unsure about your magnesium status, discuss it with your doctor. Supplementation may be necessary in some cases, but Health Hub strongly advises Magnesium supplementation should be done cautiously and under the guidance of a healthcare professional. High doses can cause side effects like diarrhea. More importantly, magnesium can interact with certain medications, including antibiotics, thyroid medications, and some heart medications. Key number 5, coenzyme Q10, CoQ10, the energy spark for the heart's engine. The heart is an incredible biological machine, working non-stop for billions of beats throughout a lifetime. To do this, the heart muscle needs a tremendous amount of energy, and this is where coenzyme Q10, CoQ10, shines. CoQ10 is a naturally occurring compound found in the mitochondria of every cell, where it produces ATP, the body's main energy molecule. CoQ10 is an essential part of the electron transport chain within mitochondria, helping to generate energy efficiently. CoQ10 concentration is particularly high in organs with high energy demands like the heart, liver, and kidneys. For the heart, CoQ10 is like the spark plug, helping the heart's engine run strongly and durably. When CoQ10 levels in the body decline, the energy production capacity of heart cells is affected, leading to weakened heart muscle and potentially worsening cardiovascular conditions. Low CoQ10 levels have been linked to heart failure and greater tissue damage in acute cardiac events. Besides its role in energy production, CoQ10 is also a powerful antioxidant. It helps protect heart cells and blood vessels from damage caused by free radicals, unstable molecules that can harm cells and contribute to aging and atherosclerosis. By doing so, CoQ10 contributes to slowing down the process of plaque formation. An important point to note is that natural CoQ10 levels in the body tend to decrease with age. Furthermore, individuals taking statin medications to lower cholesterol may also have reduced CoQ10 levels. Because statins not only inhibit cholesterol production but also the same biochemical pathway that synthesizes CoQ10 in the body. This is why some statin users may experience side effects like muscle pain and fatigue. And CoQ10 supplementation is being researched as a potential solution to improve these symptoms in some patients. While CoQ10 is present in some foods, organ meats, fatty fish, soybeans, leafy greens, the amount from diet is often insufficient to significantly increase blood levels, especially in older adults or those with health conditions. Therefore, supplementing with CoQ10 is a common way to boost these levels. Health Hub recommends that if you are considering supplementing with CoQ10, especially if you are taking statins or have cardiovascular disease, have a thorough discussion with your doctor or pharmacist. CoQ10 is generally safe, but it can interact with blood-thinning medications, warfarin, reducing their effectiveness. Key number 6, potassium, the rhythm conductor of the heart. Next, we talk about potassium, one of the most vital electrolytes in the body, playing a critical role in the electrical activity of the heart and fluid balance. Potassium, along with sodium, is one of the main ions that maintain the cell membrane potential and generate the electrical impulses needed for muscles, including the heart muscle, to contract. The balance of potassium levels inside and outside the cell is extremely important for a steady heart rhythm. Potassium's role in cardiovascular health includes stabilizing heart rhythm. Potassium levels outside the normal range, too low or too high, can cause serious and even life-threatening arrhythmias. From mild premature beats to dangerous ventricular fibrillation, maintaining potassium levels within the normal range is crucial. Blood pressure control. Potassium acts antagonistically to sodium. Sodium tends to retain fluid and increase blood pressure, while potassium helps the body excrete excess sodium through urine and helps relax blood vessels, thereby lowering blood pressure. A diet rich in potassium helps balance the effects of sodium. Supporting blood vessel function. Potassium contributes to the dilation of blood vessels, facilitating smoother blood flow. Potassium deficiency is a potential risk factor for hypertension and heart rhythm problems. Low potassium levels can occur due to insufficient dietary intake, vomiting, diarrhea, diuretic use, or certain medical conditions. So where can we find potassium? Bananas are a good source. But don't rely solely on bananas. Many other foods are richer in potassium and offer more variety for your diet. Potatoes and sweet potatoes, especially with skin. Dark leafy greens, spinach. Swiss chard. Legumes, white beans, lentils, chickpeas, dried fruits, apricots, prunes, raisins, avocado, tomatoes, and tomato products like sauce, yogurt, salmon. Health Hub emphasizes, getting enough potassium through diet is the safest and most effective method. Potassium supplementation via pills must always be done under strict medical supervision, especially for individuals with kidney disease, as kidneys excrete excess potassium, or those taking medications that affect blood potassium levels, like ACE inhibitors, ARBs, or potassium-sparing diuretics. High blood potassium, hyperkalemia, is a dangerous condition that can lead to cardiac arrest. Key number 7, fiber, the versatile, cleaner, and regulator. Finally, but certainly no less important for our cardiovascular health, is fiber. Often primarily associated with digestive health. Fiber is truly a silent hero, protecting your heart in numerous impressive ways. Fiber is a type of carbohydrate from plants that the body cannot fully digest or absorb. There are two main types, each offering distinct benefits for the heart. Soluble fiber dissolves in water to form a gel. This type is particularly beneficial for heart health because it binds to cholesterol, LDL, and bile acids. Produced by the liver from cholesterol to digest fats in the digestive tract and helps eliminate them from the body in stool. This helps lower total cholesterol and LDL cholesterol levels in the blood, a major risk factor for atherosclerosis. Good sources: oats, barley, beans, lentils, black beans, chickpeas, apples, pears, citrus fruits, flax seeds, chia seeds. Insoluble fiber does not dissolve in water. It adds bulk to stool and helps move food through the digestive system, preventing constipation, while its direct effect on cholesterol is less significant. A healthy digestive system and weight management, which insoluble fiber supports, indirectly benefit the heart. Good sources: whole wheat, wheat bran, nuts, seeds, fruit and vegetable skins. Both types of fiber help slow down digestion and absorption, especially of sugar. This helps stabilize blood sugar levels after meals, which is crucial for preventing and managing type 2 diabetes, a major risk factor for heart disease. Furthermore, high-fiber foods tend to make you feel full longer, supporting calorie control and maintenance of a healthy weight, thereby reducing the burden on the heart. Numerous large scientific studies consistently show a strong link between sufficient daily fiber intake and a significantly reduced risk of cardiovascular disease, stroke, and other major cardiac events. General recommendations for daily fiber intake are about 25 grams for women and 38 grams for men, or about 14 grams per 1,000 calories consumed. Unfortunately, the sad reality is that most of us do not meet these targets. The most effective way to increase fiber is through diet, eating more vegetables with every meal, choosing whole fruits over juice, eating legumes more often, opting for whole grains, brown rice, oats, whole wheat bread, instead of refined grains. Read food labels to find products with high fiber content. If you struggle to get enough fiber, consider supplementing with products like psyllium husk, inulin, or other types of supplemental fiber. However, Health Hub gives an important note: when increasing fiber intake, especially from supplements, you must drink plenty of water. Otherwise, fiber can cause bloating, gas, or constipation. Increase fiber intake gradually to allow your digestive system to adapt. Dear viewers, we have explored the essential roles of these 7 vitamins and nutrients for cardiovascular health. Omega-3, vitamin D, vitamin B9, folic acid, magnesium, coenzyme Q10, CoQ10, potassium, and fiber. This is not just a list of nutrients, it is scientific evidence of how we can proactively protect the body's most vital organ. Ensuring sufficient intake of these nutrients through a balanced, diverse diet rich in whole foods is the most solid foundation. Think of nutrition as a long-term investment in your heart. Instead of seeking quick fixes, build healthy eating habits daily. Health Hub always encourages you to prioritize obtaining nutrients from food sources. Supplements should only be considered when necessary and based on professional assessment. And the most important advice that Health Hub always conveys: health is a combination of many factors. Nutrition is just one part. Don't forget regular physical activity, maintaining a healthy weight, managing stress, getting enough sleep, and undergoing regular health checkups. This is a comprehensive strategy for a healthy heart. And finally, Health Hub specifically advises, all information provided in this video is for educational and reference purposes only and does not substitute for medical advice, diagnosis, or treatment from qualified healthcare professionals. If you have any concerns about your health, especially cardiovascular health, or are considering using any dietary supplement, always consult with a doctor, pharmacist, or registered dietitian before making any decisions. Thank you for joining Health Hub for this in-depth video. We hope this knowledge about the 7 golden key nutrients will be a helpful resource for you to take better care of your heart every day. If you found this information valuable, please don't hesitate to support Health Hub. Please share this video with your loved ones to spread this helpful health knowledge. Especially, if you haven't subscribed yet, hit the subscribe button for Health Hub and the bell icon so you don't miss our next scientific and practical videos. Health Hub always looks forward to receiving your feedback and questions. Please leave a comment below if you have any inquiries or would like Health Hub to create a video on another health topic. On behalf of the Health Hub team, we wish you and your family abundant health and a truly healthy heart. See you in the next video on Health Hub.